For testing isometrics of the hip, strength testing of the hip without movement, you're going to have your patient seated to do the quick screen. To do hip flexion, you ask the patient to bring their knee just slightly up off the table and hold, don't let me push down, and relax. And you want to make sure that the patient obviously doesn't have anything very acute going on in their back so that they're able to sit and take some pressure. You always want to use caution if you're applying any pressure, especially in this position if your patient is painful. So that's hip flexion, and you're obviously going to compare one side to the other. We'll do hip extension in a minute, but hip AB and abduction, you're going to simply, for abduction, don't let me bring your knees together, hold, hold, hold. Good, and then the opposite, don't let me push your knees apart, hold, good. For knee flexion, I typically will bring a hand in here to support the patient's leg. Go ahead and relax it there. And hold your leg right there. Don't let me push it down towards you. Hold, hold. Good, and don't let me pull away. Hold, hold, hold. This is for hamstrings. And relax. Good. For testing hip extension, I typically will have my patient lie prone. So I'm going to have you lie belly down. And again, you have a lot of leverage in this position, so you do need to be careful. You're going to ask the patient to lift this knee slightly up. And again, I'll watch first to see what's going on. If she looks fairly stable, I'll go ahead and apply some pressure and hold and relax. And again, if she's able to hold against your resistance, it's a good strong muscle. One last note for testing hip abductors. I'm going to have you lie on your side facing the camera. So hip abduction, especially gluteus medius, which is very often weak, you want to make sure the patient is lying stacked up. You're going to bring her leg into extension. You want to make sure you're not pulling her out of that sideline position. Extend the hip, ask her to hold right there. And don't let me push down. This is usually a very tough muscle to test. Good, and relax.